Good evening, class. We're going to spend just a few minutes getting you ready for quiz number one for your health informatics class. And we won't spend a lot of time. It's information we've gone over in the past through some of the videos and also some of the readings we've been through, but just trying to pick out a few kind of salient points that might help you, or at least give you an idea of what to review for the quiz. And one thing that we want to talk about are just some of the things, and this goes back to Era's initial article, talking about asymmetric information. And we're talking about asymmetric information. Era said it was an issue with healthcare when he wrote his article. It was published in '63. A lot of professionals, especially economists in the healthcare space, think it is still a significant issue, and that's asymmetric information. And typically we think about asymmetric information is especially between patients and providers. Patients are not always forthcoming when the providers, especially when you first go into the doctor's office, they start asking you questions, do you drink, do you smoke, what's your diet, have you been going to the gym, do your exercise? I mean, they go through a line. A lot of patients may not be as forthcoming as they should be, and that could impact the treatment plan that the provider puts together. And on the flip side of that, you've got the providers. And where it comes down to between providers and patients, providers should know more than patients. Providers, at least we assume, have been to medical school. If they're nurse practitioners, we assume that they have the nursing degrees. And it turns into a kind of a principal-agent relationship. When I go in to see the doctor, I'm the principal, he's the agent, or I'm the principal and she's the agent. So the provider should be functioning or operating in my best interest as a patient. But where we run into issues, especially in this agent-principal relationship, and when the differential or the deviation between the knowledge that I have and the knowledge that the provider has, if that continues to grow and cause issues, that's typically referred to as agency cost. And what stems or what drives this agency cost is typically I don't have the opportunity to or the means to punish the agent. If push came to shove, then I filed a lawsuit against my provider. It would be difficult for me to prove a lot of this in court. So asymmetric information is a significant issue when it comes to the healthcare arena. Also, you have uncertainty, and it's uncertainty in not only the incidence of disease, but it's the uncertainty with the efficacy of the procedures, or the efficacy of the treatment plans. And then lastly, at least maybe not lastly, but third is what we've talked about in the past, is the questions of quality. Quality of healthcare goods and services is extremely difficult to measure. And even if you go to the doctor and you don't feel the best, and they prescribe some medications or a treatment plan, and you go home in 4 or 5 days, you feel better, there'll still be quality issue, because yes, you feel better, but you don't know whether that was the best treatment plan to either make you feel better quicker or to increase or maximize the level of, quote, betterness that you would feel as a patient. So it's, they talk about it in the healthcare arena, that part of the issue of quality, it's not like buying an automobile. With healthcare, you can't kick the tires. You can't try out a physician, or you can't try out multiple physicians or test drive multiple physicians before you pick the one and pick that treatment plan that you're going to follow. And again, want to make sure everybody understands that the uncertainty in healthcare, especially, it's incidence of disease, it's efficacy of treatment, it's asymmetric information. Sometimes I go to see a physician, and I don't have a medical degree, but I feel like I know as much as the physician um, that's treating me. Last time I went to urgent care, I had a nurse practitioner waiting on me, and it was almost like I didn't think she had a clue as what she was talking about. And the other thing to remember in healthcare, information is extremely important because of information turns uncertainty into risk. And you can manage risk, but it's extremely difficult to manage uncertainty. And when we've talked about the financial coin, and I've even put a video out there that specifically talks about the financial coin on healthcare. And there's two sides of that financial coin, and on one side's the payer, on the other side, the providers, and they're both struggling over who's going to grappling over who's going to control that financial coin. On the payer side, you've got health plans, you've got government agencies, you've got self-insured individuals, private, when sometimes you can be considered private pay. You've also got employer groups that what they call ASO plans, who are decided that they want to manage the healthcare goods and services that their employees consume, and they're typically, again, called ASO plans. They're self-insured, and they're trying to manage their healthcare goods and services for their covered employees. So that's kind of examples of on the payer side. And then on the provider side, you've got doctors, you've got nurse practitioners, you've got hospitals, ambulatory surgery facilities, pharmacies, ambulatory, not only ambulatory surgery facilities, but also ancillary type healthcare services, laboratory, radiology, durable medical equipment, prosthetics, and orthotics, and they all kind of fall under this provider category. And so when it comes to health plans, especially, and it goes back to the ASO concept, you've got fully insured, and those are the type of employer groups that the health plan accepts the risk for. You've got self-insured, which again, the ASO types who want to manage their healthcare goods and services that their members consume, and the employer group at that point is taking and transferring the risk from the health plan. It transfers it to the employer group. And then you've got something called community rated. And community rated is usually, you see it in small employer groups that don't have enough critical mass to really have a statistical basis or a statistical driver to determining the premium that will be charged to that employer group by the health plan. And so what they do is they lump a bunch of these smaller health plans together, or a large grouping of health plans together, especially in a similar geographic area, and it increases the critical mass, and it's easier for the actuaries or the actuarial consultants that a health plan may be using, makes it easier for them to determine the proper premium to charge the health plans. And then we talked a little about government intervention. And government intervention, as I've discussed on more than one occasion, governments think that they know better than we do how we should live our lives. It doesn't matter whether it's CMS, the Centers for Medicare and Medicaid, it's NIH, National Institute of Health, it's CDC, it's the policymakers, and the governments, as long as they think markets are working efficiently and markets are allocating goods and services efficiently, then the government tends to stay out of a particular industry, out of a particular market. And when they come into the healthcare market, it's because they see a need to redistribute healthcare goods and services from one population to another. Maybe they think that the needy population, those that don't have the financial wherewithal to go and seek healthcare goods and services, it's an inequitable position to them. And at that point, they consider that market failure. They consider it an inefficient market, and that's when they start moving into the markets. And then we talked for a few minutes about healthcare informatics or health informatics. And the article that we used, or the one that developed the videos from, pretty much took healthcare informatics and broke it into, I'll say, three major components. If you remember the chart in that book, there was bioinformatics, and that was more the cellular, molecular level. There was, medical, clinical informatics. You can throw into that, network management, a lot of functional areas, both on the provider side and on the payer side. And that is more based on the person. So usually driven by the historical analytics of healthcare claims that providers are submitting to health plans, and health plans in turn are paying for. And then you have kind of public health informatics, which is more population based. So again, public health, government agencies tend to get into a market when there's inefficient markets or market failures, and especially they like to dabble in that population health because they think they know more than health plans and providers on how individuals, or how a population of individuals should work to control or should work to minimize the deterioration in their health status. We talked about, and actually the authors in that particular document, they talked for a few minutes about time and space, and it's a significant issue with time and space, where you have take COVID. So with COVID, in time and space, you had elective surgeries were not allowed at hospitals. Ambulatory surgery centers pretty much shut down because most of them were driven by elective surgeries, or at least in most states, they minimized the number of elective surgeries that could be performed. Doctors' offices typically didn't see patients. They had the mask mandates. You had issues with getting your pharmaceuticals, getting your scripts. There were just a lot of issues. And so what you saw a huge bump in during COVID was telemedicine, telehealth, teledoc. The health plan I worked for during COVID used Doctors on Demand, and you had a little app on your phone, and you could get on your phone, and through FaceTime, you could talk to your doc, and the doc would, to me, somewhat disconcerting because they couldn't reach out and touch you, but you're talking to them, via some type of visual communication through your mobile device or your laptop, and they were prescribing medications and providing advice, and for the most of us, it was a successful opportunity or successful visit when it came to seeking healthcare goods and services. And I think because of COVID, I'm a little more comfortable with seeking this virtual healthcare goods and services than I have been in the past. And so that's kind of what we're talking about, time and space. And then we jumped into kind of moved more into, because I wanted to get individuals in this class the opportunity to kind of compare business intelligence, health informatics. I know this class is geared more toward health informatics because that's my background, but a lot of the skill set, let's call it, or a lot of the human capital, you'll hear me talk a lot about human capital, but a lot of the human capital that it's a skill set within business intelligence, it's the same skill set you're going to use in health informatics. So a lot of the concepts we're going to talk about going forward, we're going to spend a lot of our time with kind of domain knowledge in healthcare, but a lot of the concepts that we use, you can take and just cookie cutter over to business intelligence. And I've always viewed business intelligence and health informatics as They're just like they're cousins. They're just cut from the same piece of cloth. It's the same analytical mindset. It's the same investigative approach. It's individuals that are continuing to ask questions. So it doesn't matter whether you're in healthcare or you go to a large corporation managing, let's say you go to one managing restaurants, you go to work for Pizza Hut, or you go to work for Starbucks, or you go to work for McDonald's, or go to work for Saks or Nordstrom's, or there's the concepts and the skill sets on both sides when you're talking about business intelligence and healthcare informatics. The basic concepts and approaches to doing your day-to-day activities are pretty much the same. And so I think you'll understand that when then they talked about business intelligence and health economics or health informatics, and when they're talking about data and information, you want it to be accurate, you want it to be valuable and timely and actionable, and people will argue over which is the most important. Accurate is correct with no errors. It helps to build the reputation of the analytical team. And if it's valuable, it can be used to either increase revenues or decrease costs. Valuable, and you can make business decisions and expand that efficient horizon on the company that you're working for. Timely, the authors talked about the spirit of the staircase, where a lot of times you don't even think about the timely approach to providing data. And then most importantly is actionable, because it's going to drive business decisions. It's going to drive strategic planning. I had an individual that worked for me when I had a medical informatics team at HealthNet, and I'd ask him to generate a listing of hospitals and generate the financials for those hospitals. And I just wanted to kind of, this was his first project working by himself, so I turned him loose on it, and he came back to me, and he had a nice spreadsheet, and he had all the hospitals in the San Diego market down kind of the vertical axis, and across the top he had dollars, and had dollars per admission and dollars per discharge. And I mean, it was a really nice spreadsheet. And I would, sitting there looking at the data, and I looked at his code, and because the data didn't look exactly right to me, and I started looking through his code, and I asked him to come in, and we're talking about it, and I said, walk through your code for me. And because I'd given him the information, or the request would be, I'd like to see the hospitals arrayed by total dollars that went out the door. Total dollars went out the door from the health plan. And unfortunately, he didn't understand enough about the domain logic, the domain knowledge, that he had pulled bill dollars. He had the bill charges for all of these hospitals. And as we sat there and talked through it, even though I discussed it, I thought on multiple occasions, it still didn't click for him. And so, because in healthcare, you've got bill charges, which we'll get into in some later chapters, but you've got the bill charges, and that's basically what the providers charge for those goods and services. You've got the allowed amount, and the allowed amount is what the contract allows for that particular good and service. When I say contract, a contract either with a payer of some sort. And then you've got the paid dollars. And the paid dollars will be the dollars that will go out the door from the payer to the provider. And the difference between allowed and the paid dollars is the differential that I call other party liability. It's the patient share. Could be copay, could be coinsurance, could be deductible. And so as we went through his code, I could tell the information that he gave me was accurate, because I could tell by his code he was pulling the right data from the repository we had. He was pulling the right data, or pulling the numbers for the right data in his mind that meant the paid dollars. And while the information he provided me was accurate based on bill dollars, it wasn't valuable because I needed information based on paid. It wasn't timely because we had to turn around and rework the information, and it wasn't actionable because I couldn't do anything with the data. So to me, it comes down to I'm looking at value and I'm looking at actionable, at least from my perspective, as being really important when it comes to providing information. It has to be great. It has to be accurate and it has to be timely. But the individual, and we'll call them the end user that requested the information, it has to be information that they could take and build a strategy with and hit the ground running with. And when you're driving information, or when you're whether it's business intelligence or health informatics, uh, you want the results as we've talked about, accurate, valuable, timely, actionable. But sometimes, and it depends on who the requester is, sometimes accurate information can be surprising, it can be counterintuitive, it can be threatening to some groups, because what you want is you want accurate information. You don't want errors, because errors erode the reputation of the team, um, called into question the veracity of the information you're providing, can actually damage the company you're working for, because if they take inaccurate information and run with it, they can put strategic planning or strategic processes in place that are going to be detrimental to the company. So, yes, you want it accurate, but even when you provide accurate information in a lot of areas or in a lot of instances, especially in functional areas that have a preconceived notion of the story they're trying to tell, and if the information you give them doesn't match that um, predetermined idea of what the story is that they want to tell, you're going to get pushback. And as doesn't matter if you're an analyst in business intelligence or an analyst in health informatics, you will learn along the way that you're going to have to develop a thick skin, because you're going to be berated from time to time and called into question about the or regarding the accuracy of your information. And as long as you're comfortable with the accuracy of that information, you just need to learn to hold your ground. Let's see. We also talked about information that can be used, especially in the healthcare marketplace. So if you're working in a health informatics shop or a health informatics team, you're going to use that information. It's going to, either optimize cost and revenue. So you're either going to be minimizing cost or maximizing revenue. You're going to be theoretically improving, or at least you hope we are, improving treatment protocols, because a lot of the work that we do in health informatics goes back to the profit function. And remember, go back to your old micro classes. What's profit? Revenues minus cost. If you're on the health plan side, you're going to be trying to minimize cost. If you're on the provider side of that financial coin, you're going to be trying to maximize revenues. So the information you're providing from a financial perspective is extremely important, but it's also extremely important from the patient's view, because they want the treatment protocols to be accurate. They want to have access to the highest quality of care. And again, it'll come back to that quality issue. You, as a health informatics professional, need to be able to help patients understand and try to maximize the quality of the services that they receive, because at the end of the day, you want the treatment plan or the treatment protocols for the patients to drive the best possible outcome for the episode of care that they are suffering from. And then lastly, and I can't remember which video we might have talked about, and again, it doesn't matter whether it's business intelligence or whether it's health informatics, one thing that you need to understand is if you go into that job interview you need to have some level of domain knowledge. And it, again, doesn't matter whether it's a healthcare market or healthcare job or a job at McDonald's or Starbucks. You need to have at least a basic understanding of the industry, the market, um, the discipline you're talking about, the profession that you like to move forward in, the field of study, the activity you're going to be involved in. I mean, even if you want to go in and get a job at Starbucks, you need to understand the concept and what they do at Starbucks and how they go about doing it. If for no other reason, just go in and get you a cup of coffee at Starbucks and sit down and just watch. Just watch the operational process, watch the infrastructure, watch the way that they deal with customers. It's kind of like if you've ever flown Southwest, it's a unique experience. Very customer friendly, very customer oriented. They want to make sure that flying is fun. Southwest can load a plane faster than any other airline because there's no seat assignments. People aren't arguing over seats. It's you get on that plane and it's first come, first serve. Put you behind in a seat and sit down and let the next person come by and get their seat. And just a word of advice, and I hope you'll be able to take some of these tools that we're developing on this health informatics, I guess, journey together. But there's a few things that I hope you take from it and never forget. Always do what? If there's a question involved, always follow the money. Always remember that there's two sides, and it's not just healthcare to that financial coin. There's two sides to every financial coin in every industry that you're functioning in. And then lastly, if you're going out into the job market, just get at least you need at least a rudimentary knowledge of the job market that you're trying to function in. And with that, we're going to kind of wind this up. I think that I've gone over and I've pretty much got the quiz ready to go. And I think if you've been watching the videos and you pay attention to all the videos and making comments on them, I think you should do very well when it comes to this first quiz. Thank you.